Bismillahirrahmanirrahim. Quote of the day: every day is a change to be better. Assalamu alaikum. Today, the topic of my presentation is dengue fever under kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is global burden, epidemiological determinants, classification, laboratory diagnosis, treatment, prevention and control, and recent updates. By the end of this presentation, participants would be able to describe epidemiological determinants, laboratory diagnosis, prevention, and treatment of dengue fever, and at the end, there is an MCQ session. Problem statement: dengue virus are spread to people through the bite of an infected Aedes species. These mosquitoes also spread Zika, chikungunya, and other viruses. Dengue is found in tropical and subtropical climates worldwide, mostly in urban and semi-urban areas. The global incidence of dengue has grown dramatically, with about half of the world's population now at risk. Each year, up to 400 million people get infected with dengue. Approximately 100 million people get sick from infection, and 4,000 die from a severe dengue. Distribution and outbreak: the disease is now endemic in more than 100 countries in the WHO region of Africa, America, Eastern Mediterranean, Southeast Asia, and the Western Pacific. The America, Southeast Asia, and Western Pacific region are the most seriously affected, with Asia representing almost 70% of the global burden of the disease. The American region alone reported 3.1 million cases, with more than 25,000 classified as severe. Despite this alarming number of cases, deaths associated with dengue were fewer than in the previous year. This is the area map and the area which are endemic with the dengue fever. Epidemiological determinants: the dengue virus from a distinct complex within the genus Flavivirus based on antigenic and biological characteristics. There are 4 virus serotypes which are designated as DEN1, DEN2, DEN virus 3, and DEN B4. Infection with any one serotype confers lifelong immunity to that virus serotype. And the vector which is responsible: dengue is transmitted to people by the bite of an infected yellow fever mosquito, Aedes aegypti, or the Asian tiger mosquito, Aedes albopictus, which are found in tropical and temperate zones throughout the world. Risk factor: common in all group of ages, and pre-existing antigen and anti-dengue antibody, previous infection and maternal antibody, high risk in secondary infection, high risk with 2 or more serotypes circulating simultaneously, genetic, white may be greater risk than black, and the virus strain: certain genetic strain virus cause dengue in primary infection. And the host: infective stage of the dengue virus 1 day before onset of fever to day 5, and intrinsic incubation period is 4 to 6 days. And the high risk patient are extreme age, pregnancy, any condition prone to heavy blood loss like peptic ulcer disease, menstruation, hemolytic anemia, G6PD deficiencies, thalassemia, patient on steroids and NSAIDs. Any chronic condition are more risk for developing a complication if these patients are suffering with dengue fever. The population of Aedes aegypti fluctuates with rainfall and water storage. Its lifespan is influenced by temperature and humidity. Survival between 16 to 30 degrees centigrade, and the relative humidity is 60 to 80%. It breeds in the container in and around the houses. These are the environmental factors which are responsible for the spread of dengue virus. How does dengue spread? by the bite of mosquito Aedes aegypti bites dengue infected person and mosquito ingested blood with dengue virus take 8 to 10 days for dengue virus to inoculation. Dengue infected mosquito bites another person and then that person gets dengue 4 to 13 days later. These are the clinical features which are seen in the patient of a dengue fever, and the most common is a fever. Almost its frequency is 100%, and headache, muscle pain, retroorbital pain, arthralgia, anorexia, nausea, diarrhea, vomiting, fatigue, cough, and the signs are rash, fatigue, swollen red hands, and hepatomegaly, and these are the frequency of these sign and symptom. There are three types of dengue fever: classic dengue, dengue hemorrhagic fever, and dengue shock syndrome. And the most rare one is dengue shock syndrome. Current diagnostic test with pros and cons. Diagnostic test for detecting the dengue fever is virus isolation, and the advantage is this test is specific and reliable result, but this is also a time consuming, lower sensitivity, expensive, and laborious steps require appropriate facility and expertise skill and require acute sample within 0 to 5 days. PCR technique, this is also high sensitivity, high specificity result given less than 24 hours and reliable results. But this test is expensive, requires specialized instrument, require careful handling to avoid cross contamination and during the procedure and involve hazardous chemical, and it also required the acute sample within 0 to 5 days. NS1 detection, it is inexpensive, rapid result, and easy to operate. But this test has lower sensitivity, high cross reactivity, false positive and negative result. This test also require acute sample within 0 to 5 days. And serological test, IgG and IgM antibodies. This test is also inexpensive, rapid result, easy to operate, but it also has lower sensitivity, high cross reactivity with other flavivirus or antigen, and false positive or negative result, and it requires febrile sample 5 days above. Treatment of the dengue fever, supportive care such as fever reduce and painkiller can be taken to control the symptom of muscle aches and pain. The best option to treat these symptoms are acetaminophen and paracetamol. NSAIDs such as ibuprofen and aspirin should be avoided. These anti-inflammatory drugs act by thinning the blood, and in a disease with risk of hemorrhage, blood thinners may exacerbate the prognosis. For severe dengue, medical care by physician and nurses experienced with the effect and progression of the disease can save life, decreasing mortality rates to less than 1% in majority of countries. Now comes the prevention and control. If you know you have dengue, avoid getting further mosquito bite during the first week of illness. Virus may be circulating in the blood during this time, and therefore you may transmit the virus to new uninfected mosquito who may in turn infect the other people. The proximity of mosquito vector breeding sites to human habitation is a significant risk factor for dengue at present. The main method to control or prevent the transmission of a dengue virus is to combat the mosquito vector. This is achieved through various techniques and procedure. Prevention of a mosquito bite. Preventing mosquito bite for assessing egg laying habitats by environmental management and modification, disposing of solid waste property and removing artificial man-made habitats that can hold water, covering and emptying and cleaning of domestic water storage container on a weekly basis, applying appropriate insecticides to water storage outdoor container. Prevention for breeding places. This can be doing by the block step, break up hardened soil, lift and empty flower pots, plates, overturn pails and whip their rims, change water in vases, keep roof gutter clear and place BTI insecticides. The use of personal protective from mosquito bites. Using of personal household protection measures such as window screen, repellents, coils, and vaporizer. These measures must be observed during the day, both inside and outside of the home, because the primary mosquito vector bites throughout the day. Wearing clothes that minimizes skin exposure to mosquito is also advised. Use insect repellents. Use Environmental Protection Agency insect repellent with one of the active ingredient below. When used as a directed, EPA registered insect repellent are proven safe and effective even for pregnant and breastfeeding women. Community engagement. Educate the community on the risk of mosquito-borne disease, engaging with the community to improve participation and mobilization for sustained vector control. Active mosquito and virus surveillance. Active monitoring and surveillance of vector abundance and species composition should be carried out to determine effectiveness of control intervention. Prospectively monitor prevalence of virus in the mosquito population with active screening of sentinel mosquito collection. Virus surveillance can be combined with clinical and environmental surveillance. In addition, there is ongoing research amongst many groups of international collaboration in search of novel tools and innovative strategies that will contribute in global efforts to interrupt transmission of dengue. The integration of vector management approaches is encouraged by WHO to achieve sustainable, effective, locally adapted vector control intervention. WHO response towards the dengue fever. WHO response supports country in the confirmation of outbreaks through its collaboration network of laboratories, provide technical support and guidance to countries for the effective management, support countries to improve their reporting system and capture the true burden of disease, provides training on clinical management, diagnosis, and vector control at the country and regional level, formulates evidence-based strategies and policies, support countries in the development of dengue prevention and control strategies and adopting the Global Vector Control Response 2017-2030, reviews the development of new tools including insecticide products and application technologies, gather official records of dengue and severe dengue from over 100 member states, and publish guidelines and handbooks for surveillance, case management, diagnosis, dengue prevention, and control for member states. Vaccination against dengue. The first dengue vaccine, Dengue Vaxia, advised by Sanofi Pasteur, was licensed in December 2015 and has now been approved by regulatory authorities in 20 countries. The vaccine is targeted for persons living in endemic areas, age 9 to 45 years of age, who have had at least one episode of dengue virus infection in the past. There are several other vaccine candidates in developing, including live attenuated inactivated DNA and subunit vaccine. What is the vaccine eligibility criteria for dengue fever children and adolescents 9 to 6 years age with laboratory confirmation of previous dengue virus infection and living in dengue endemic area are eligible for dengue vaccine. Dengue vaccine required 3 doses and can prevent dengue illness, hospitalization, and severe dengue fever, all 4 dengue viruses. Pre-vaccination screening for previous dengue virus infection. Laboratory confirmation of previous dengue virus infection is required and can be obtained by evidence of a prior acute dengue virus infection with positive dengue PCR test result or positive dengue NS1 antigen test or positive test result on pre-vaccination screening test. The vaccine schedule and dosing preparation require mixing of diluent and nebulized vaccine antigen in single-use vial 0.5 ml per dose. Route is subcutaneous injection and the schedule is 3 doses in a series given in a 6 months apart. Children and adolescents with dengue should, with at least 6 months after the date the dengue infection is confirmed, to begin the vaccine series. Dengue vaccine safety. When used in individuals with laboratory evidence of past dengue virus infection, the dengue vaccine is very safe. The most frequently reported side effects are headache, injection site pain, malaise, asthenia, and myalgia. And dengue vaccine efficacy among children 9 to 16-year age with previous dengue virus infection. Dengue vaccine has an efficacy of about 80% against the outcome of symptomatic virologically confirmed dengue hospitalization for dengue and severe dengue. Outcome virological confirmed disease, then the vaccine efficacy almost 82%, and in hospitalization cases the efficacy is 79, and in a severe disease the efficacy of vaccine is 84%. What is the duration of vaccine protection? Recent studies have shown that dengue vaccine provide protection against hospitalization and severe disease for at least 6 years after the last dose of the series. Studies are ongoing to determine how long protection may last. What's the indication in pregnancy and lactation? Pregnant people were not specifically enrolled and studied in the vaccine trial, although no significant difference in adverse pregnancy outcome between vaccinated and unvaccinated people were found. The number of pregnant people enrolled was too small to determine the effect of dengue vaccine on pregnancy. Vaccine providers should consider the risk of dengue virus infection when making a recommendation for vaccination for pregnant people. Pregnant people are at increased risk of dengue-related complication, and in the lactation, no data are available to evaluate dengue vaccine and breastfeeding. Vaccine availability. Dengue vaccine became commercially available in 2016 in 11 countries. In 2019, it was approved for medical use in the United States. It is on the World Health Organization list of essential medicine. Dengue vaccine are not commercially available in Pakistan. The WHO recommends that countries should consider vaccination with dengue vaccine only if the risk of severe dengue in seronegative individual can be minimized either through pre-vaccination screening or recent documentation of high seroprevalence rates in the area, at least 80% by age. A pregnant woman already infected with dengue can pass the virus to her fetus during pregnancy or around the time of birth. Dengue can have harmful effects, including death of the fetus, low birth weight, and premature death. Dengue during breastfeeding. According to expert, breastfeeding is safe if the mother is infected with dengue. The risk of transmission of dengue virus from mother to the baby through breast milk is next to negligible. Evidence show that the colostrum, the first breast milk, and breast milk have anti-dengue antibodies which make the baby immune from the infection. According to the guidelines by WHO, it is important to breastfeed the newborn during maternal dengue infection, as breast milk has lot of nutrients and antibody which help and protects the baby, prevent dehydration, and maintain emotional well-being in the baby. Now it's time for the recent updates. What is the situation of dengue fever in Pakistan? Dengue is endemic in Pakistan with the last notable outbreak with 53,498 cases and 95 deaths being reported between September to December 2019. From 1 January 2023, a total of 60,906 cases included 275 deaths. Case fatality ratio almost 0.4 have been reported from 4 provinces including Punjab, Khyber Pakhtunkhwa, Sindh, Balochistan, and federally administered Islamabad and Azad Jammu Kashmir. As of January, Punjab province reported the highest number of cases with 24,146 cases and 127 deaths, and case fatality ratio is 0.5, accounting for 49.4 and 69 all cases and deaths respectively. The deaths were mainly reported from the Lahore district. Public health response. The federal and Provincial health department are implementing public health measures including the following: vector surveillance and control activities as a part of integrated vector management. Surveillance of AIDS larvae and space spraying activities are underway in Punjab provinces. Between indices of AIDS larvae in all household and container indices, percentage of water holding container infested with larva or pupa have fallen below 2, which is less than the threshold of 5. With the opening of field hospital in Lahore, fumigation and spot check have been carried out in Rawalpindi and in Islamabad city. In Islamabad, multi-sectorial coordinated activities including vector surveillance, larva source management, destruction of mosquito breeding site, active case and contact finding, clinical management of patient, waste management, space spraying, and indoor residual spraying have been launched to control the dengue outbreaks. WHO country office is supporting the government of Pakistan by undertaking the following response activities: strengthening of laboratory and hospital-based disease surveillance in all endemic provinces and at the national level using existing opportunity of integrated disease surveillance, field epidemiology and dengue surveillance cell. Establish data and report collection center at WHO country office, provided required diagnostic kits, medicine, pesticide, and long lasting nets to ensure the continuity of essential care at all levels. In addition to the provision of long lasting insecticide, treated bed nets for hospital patients in Karachi, Sindh province, train healthcare providers from all endemic provinces and districts on the management of dengue cases at various levels of healthcare delivery system. Provided training on vector surveillance and vector control, including source reduction during house visit at the regional level. Training included selected entomologists from national and provincial program and academia. Collaborated with patron and national and provincial health ministries on raising community awareness campaign by provision of information, education, and communication material. Dengue Expert Advisory Group. Dengue endemic started in 2011 and then Dengue Expert Advisory Group was formed. It is primarily concerned with the clinical management of dengue and it's comprised of a group of clinicians who work to analyze the data of previous year. In the light of the analysis, we develop treatment protocols, guidelines, and give strategic advice to the provincial government of Punjab how to improve dengue control program. Mosquito sterilization offers new opportunity to control chikungunya, dengue, and Zika virus. Now it's time for the MCQs. Dengue is a viral infection that causes fever, itches throughout the body, and in severe cases, bleeding in multiple areas. How is the dengue virus transmitted? By person to person physical contact, by touching animals, often pets that are infected with the virus, but through tiny droplets expelled when an infected person cough or sneeze, via mosquito that carry the virus and bite people, or a blood transfusion.
D.
D is the correct answer, right? A patient presented with fever, chills, severe headache, pain around the eyeballs, muscle, and severe bone pain. He also gave history of mosquito bite. On examination, there was maculopapular rash and lymph node were enlarged. Clinicians were suspecting some viral disease. Lab investigation show positive IgM antibodies. What is the likely diagnosis? Chickenpox, dengue, malaria, measles, typhoid.
B.
Yes, B is the right answer, dengue. A 25-year-old man presented to medical OPD with complaint of severe body ache along with high-grade fever and retroorbital pain for last 5 days. Which of the following test would a doctor would recommended being suspicious of dengue fever? PCR, NS1, virus isolation, serological test, or a viral marker?
B. NS1.
D is the right answer, serological test, IgG or IgM. In the primary dengue virus infection, a low titer antibody response is observed with IgM first produced and IgG detectable in the end of the first week of disease. A low titer antibody response is observed when IgG first produced and IgM in the end of the first week. IgM is detectable throughout the acute illness starting from day 1 of infection. IgG is only detectable in secondary infection. The right answer is A. The first dengue vaccine was developed by Sanofi Pasteur in 2015, but still it is not commercially available in many countries and its use is limited because of high cost, low effectivity, increase the risk of severe dengue, less safety in previously infected individuals, and production is low.
A.
C is the right answer. Increase the risk of severe dengue in those who have previously been infected. A 12-year boy was brought to peace by his patient with active complaint of vomiting, retroorbital pain, fever, and body pain. His lab investigation showed thrombocytopenia and NS1 positive. What would you not recommend him as a doctor to relieve his symptom? Acetaminophen, paracetamol, ibuprofen, oral salt, increased fluid intake.
C.
C is the right answer, ibuprofen. Which of the following is not eligibility criteria for dengue vaccine? Age 9 to 16 year, people who have been infected previously, people living in endemic area, people living in area where there is ongoing outbreak, giving a 3 dose of a vaccine.
E.
D is the right answer. People living in an area where there is ongoing outbreak. E is the eligibility criteria. It is not eligibility criteria is mentioned in the statement. Dengue is a viral infection transmitted to human through the bite of infected mosquito. Which of the following is not true about dengue fever? It is found in tropical and subtropical climates. Dengue virus has 4 serotype. Infection with any type of serotype does not make an individual immune to other type. Dengue is less severe in previously infected person. A single individual can be infected 4 times. D is the right answer. Dengue is less severe in previously infected person. Which of the following is not true in case of pregnant or lactating mother infected with a dengue virus? Pregnant lady can transmit the infection to her baby. There is no risk of any harm to the fetus. The risk of transmission to baby through breast milk is low. There are chances of fetal death or premature babies. Breast milk provide antibody which is safer for child.
A.
B is the right answer. There is no risk of any harm to the fetus. Pregnant lady can transmit the infection to her baby. This is a true statement. A 40-year-old lady presented to medical emergency with complaint of bloody vomiting, nasal and rectal bleeding. She was giving history of severe body ache and high-grade fever for last 4 days. Her vitals were normal. Her tourniquet test was positive and CBC shows a platelet less than 1 lakh. Which of the following would she is suffering? Probable dengue, confirmed classical dengue shock syndrome, dengue hemorrhagic fever, or a dengue fever?
D.
D is the right answer. This is the key of my MCQs, YouTube link of my presentation, and thank you.